Last day of October, a lot of strides made in the fight against breast cancer.
In fact, hospitals here in East Tennessee say they can now provide the same level of care you'll find in bigger cities.
When someone is diagnosed with breast cancer, it takes a whole team to fight it. The staff at the Tenova North Knoxville Medical Center in Powell sees new patients every day.
We saw 6 new patients today, and just getting them through breast cancer treatments, tell them they don't have cancer anymore, to enjoy their lives and follow up with routine mammograms. I think it's part of why we do what we do.
Medical Director of Radiation and Oncology, Dr. Srinivas Bopanna, says no longer do you have to drive hours to get the best treatments.
You don't need to go to Vanderbilt or some major academic center. We have everything that any major academic center has, and we have great doctors.
Dr. Bopanna says having technology like 3D mammography allows doctors to pick up smaller tumors not always seen with 2D machines.
So even if you have the technology, you have to have the radiologists know how to read those.
That's where LaDonna Goodell comes in, the Director of Imaging Services.
Patients will come to us and they do state like, hey, I felt this little lump, and then most of the time we are able to discern whether or not it's, benign or malignant at that point.
Her team knows what to look for, but says there's things you can look for at home too.
Exams at home, and that can begin at any age. So if you feel like you feel something like a lump, anything like that, absolutely reach out to your primary care physician.
Early detection is key to saving a life.
Knowing your risk factors, seeing if you have a family history of it, getting mammograms, a new recommendation at age 40, start it early, come every year.
I think the most important part is just to make sure that if you feel something, say something.
Yeah, they say it's important to raise awareness about breast cancer during October and all months of the year.